Hello, and welcome to the MedSurg Nursing Journal podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. Before we get started, we have a special offer for our listeners. You can save 50% off 1- and 2-year subscriptions to MedSurg Nursing, the official journal of the Academy of Medical Surgical Nurses. Simply visit medsurgnursing.net, click subscribe, and enter promo code MSJSAVE50 to take advantage of this special discount. In this episode, MedSurg Nursing Journal editor Dr. Dottie Roberts talks with Dr. Sonya Blevins, the Director of Nursing Licensure and Compliance at Southern New Hampshire University in Manchester, New Hampshire, a past member of the MedSurg Nursing Journal Editorial Board, and an author of the journal's Nurses as Educators column. Dr. Blevins discusses the role nurses play in managing healthcare cost and quality, the value of the teach-back process and how nurses can teach patients about self-care strategies, and the importance of nurses as educators. We are pleased to present Dr. Roberts' interview with Dr. Blevins.
Hello, I'm Dottie Roberts, editor of MedSurg Nursing, official journal of the Academy of Medical Surgical Nurses. I'm very pleased to be here today with Dr. Sonya Blevins, past member of the journal's editorial board and current author of the popular column Nurses as Educators. Of the many roles nurses play, the role of educator has always been one of my favorites, and I'm excited to talk more about that role with Sonya today. So to start, Sonya, please tell us a bit about your journey as a nurse educator and how you were initially drawn to that path.
Actually, my journey as a nurse educator began when I was actually in my master's program at Syracuse University. I was working on an obstetrics floor, and while I was, doing my practicums for my adult nurse practitioner degree, I was working night shift, and I noticed nursing students from a local university who came to do their clinical rotations. And the one thing I noticed is the instructor kind of left them there and went to other areas without following up on the students. And the students initially just looked lost. They had that deer in headlights look. And so I was charge nurse that night, and I remember splitting them up. There was 3 of them. I split them up, one with each nurse, and we took them and we started teaching them. It was when I went in to do patient assessments, they went in with me. When I found something, I was like, okay, come here and see this. Or if I was doing a procedure, I drew them in. And then about halfway through, we switched students. And so that the students could see another round of what the nurses were doing, from that actually 7 to 11 part of night shift. And it just really stuck with me. When one of the students came up afterwards and they said, I learned more in 4 hours than I've learned the entire semester. And while I appreciate the compliment, it really got me to thinking about how important that teaching moment is, what the impact I made on their lives, whether they became an obstetrics nurse or whether or not they followed some other path. I gave them a good foundation for what they needed in that course. And so that really started my interest in nursing education. And so instead of following the nurse practitioner track, down the road, I ended up going into the nurse educator role, which led to my first role as a faculty member in an associate degree program nearby. So that's how my role started in education.
Well, that's really cool. What a great story. So when we're educators on the floor, there's no telling who we might be impacting, right?
Exactly. We have such an impact regardless of whether it's patients, families, students, or even fellow nurses.
Well, I've often told students and orientees that nurses teach like they breathe, naturally and continuously. What do you think, Sonya, about the criticality of the nurse's role as educator?
I think it's so important. With nurse educators, it's critical regardless of their role that they're teaching. As nurse educators, we have such a broad spectrum of coverage. We can teach in pre-licensure programs for those students that are wanting to become nurses, or in, post-licensure programs like graduate school and that sort of thing. But we also have the opportunity to teach patients at the bedside. Every time we do something at the bedside, we're teaching a patient. We're assessing where they're at in their knowledge base. and what they need to be successful in their care. We're also educating family members because they're part of that continuum of when we're not only teaching patients, we're teaching their family members, because the family members are going to be there to support that patient as they go home and, they're dealing with this new diagnosis or continued care. But the other part of that spectrum that I really like about nursing education is that we also have staff development, whether it's staff development for an entire hospital or for a clinic or for a unit. As a nurse educator, you're impacting the lives of, practicing nurses, improving their skills, building upon their current expertise, and really incorporating those evidence-based practices into what they do on an everyday basis, with patient care and how they handle different situations.
Well, in that role as a nurse educator, what part do you think nurses play in managing healthcare cost and quality?
I think it always goes back to looking at evidence-based practice. As educators, we are always looking for the latest evidence. What is going to improve patient care? What's going to improve our education to whether it's students, nurses, or patients and families? What is that latest evidence? And we all know that when you incorporate that latest evidence, most of the time it's been shown to be cost effective. It improves patient safety measures, patient outcomes. And I think that's the key with education from a nursing perspective, is really reaching out and getting that evidence-based research and those guidelines and really making sure that those incorporated into whatever setting, an educator may be in.
Okay. Let's talk a bit now about identifying the teachable moment. You mentioned that, I think, in some of your initial comments. How can nurses be alert for the opportunity to teach their patients about critical self-care strategies?
I think it really goes back to when you develop a rapport with the patient, building that trust with the patient, getting to know the patient and showing you're interested in what they're saying and what's going on with them. By developing that rapport with the patient and their family members, you can pick up on those cues through conversation of what they may be confused about in terms of, a new medication, or like if they're learning to give themselves insulin for the first time. You can start to pick up on those cues of what they're confident in, what they're not confident in, and areas that they may need further education. So I think those teachable moments really go back to developing that rapport with the patient so that you can pick up on those cues and you can ask further questions. You can probe into it. Well, tell me a little bit more about that. How do you feel about giving the insulin? Are you nervous about giving the injections? I think that just picking up on those cues is so critical. And part of that is just getting to know the patient.
Well, that's a good segue actually into the next question, because obviously time has gotten shorter with our patients. I definitely understand the need for that rapport, but time's gotten shorter over the years. Patients in our care are often sicker. How can nurses determine the most important topics to teach a patient in this short time?
I think that's when the nurse needs to really analyze what's nice to know versus what they need to know. Because every patient is unique. Every patient has a certain set of disease processes going on, different medications. And I think the nurse really has to look at, okay, what does the patient need to know to be successful in their care? What does the family need to know to help the patient be successful in their care? So I think a lot of times that's the first thing they have to do, is really look at what's nice to know versus need to know. The nice to know can be handled down the road, but the need to know, the most critical elements need to be handled there. And then the other thing is, because that time is so short, is to really, when we're doing things in the patient's room with them, whether it's an assessment or we're giving medications, teaching as much as we can during those moments, but also asking questions, because that will really cue in the nurse to what do they really need to know. And out of that, what do they need to know? What are the things they don't know? So that we can really tailor that plan to be patient specific.
One of the strategies we see promoted so much anymore is the teach back strategy. Mm-hmm. So, Sonya, what's your thoughts about the value of that strategy, particularly given how busy nurses are sometimes?
I think the teach back strategy is appropriate for that. It helps to narrow down those areas that the patient is strong in and those patients that the patient may be a little bit weaker in, and what the nurse can do to really help strengthen those weaker areas. You can also, with the teach back method, when not only you get information back from the patient or seeing a demonstration from the patient, you're really able to see their nonverbal cues. And we all know, with looking at a person's nonverbal cues, you can understand, you can look at them and understand if they're really getting it or not, getting that aha moment. Okay, I've got this now. So I think the teach back, is not only just what they're, regurgitating back to you, it's also looking at their nonverbal cues to see if they're really comfortable in doing what they say they're going to be able to do.
What a great point. Yeah. You mentioned a little bit ago engaging with the family. So how critical do you think that partnership with the family or other support persons is in our efforts to provide patient education?
I think family members are critical to patient education. Without them, it really hinders the success of the patient, because we all have a common goal, whether you're the nurse providing the education or the family member. We want the patient to be healthy. We want them to have good outcomes. We want them also to be safe with their care. And I think having those family members present and to understand, they're going to be the ones that once that patient leaves, the clinic, or they leave the healthcare facility, it's going to be the family members at the bedside encouraging the patient, helping the patient. And the more knowledgeable they are, the more they can help the patient. And let's face it, with patients, they get so much information thrown at them when they're in a healthcare setting, clinic or hospital alike. And so having that family member to help sometimes clarify, what was heard or what was meant, or, the family member saying, hey, I really think we need to call the doctor's office and, get some clarification on this because that's not really clear. That can be a patient safety moment right there, because if they're not clearly, say, on a medication dosage, what if they overdose or what if they underdose? The family member being there to either help provide clarification or to say, hey, I think we need to call the provider's office and really get more information and more clarification on this so that you're safe.
Great points. Yes. Well, we're about to end our time together today, Sonya, but what would you like to reinforce for our listeners concerning the role of nurses as educators?
I think with nurses as educators, the beauty of nursing, and especially with nursing education, is that we have so many different opportunities where you can teach, whether it's pre-licensure, graduate, staff development, patient education out in the community. There's so many different opportunities that nurse educators have. And it's the flexibility. It's, you have that opportunity to do all of these, different things. But I think one of the things that, we as a nursing profession have heard time and time again is that we're in a nursing faculty shortage. And so that is always going to impact, if we think about it, that impacts nursing, which if we don't have enough nurses, that impacts the nursing shortage, which impacts patient safety and patient outcomes. So it's a trickle down effect, when we think about it. So just, the beauty of nursing education is we have all these opportunities, but I think we have to, as a profession, continue to work on increasing the number of qualified nursing faculty that we have to teach, nurses, because without nurses, that ultimately impacts healthcare altogether.
Well said. Dr. Sonya Blevins, thank you again for talking with me today about nurses as educators. Many thanks to our listeners as well.
The MedSurg Nursing Journal podcast series is owned and produced by Genetti Publications Incorporated, all rights reserved. No portion of this podcast may be used without written permission. Dr. Sonya Blevins is the Director of Nursing Licensure and Compliance at Southern New Hampshire University in Manchester, New Hampshire. She is a past member of the MedSurg Nursing Journal Editorial Board and currently serves as author of the journal's Nurses as Educators column. Dr. Dottie Roberts is a contributing faculty member at Walden University in Minneapolis, Minnesota, a nursing online faculty member at Southern New Hampshire University in Manchester, New Hampshire, and the editor of MedSurg Nursing Journal. For archived episodes of this podcast and to learn more about MedSurg Nursing, visit the journal's website at medsurgnursing.net. You can also subscribe to the MedSurg Nursing Journal podcast wherever you get your podcasts. And remember, as a listener, you can save 50% off 1- and 2-year subscriptions to MedSurg Nursing Journal. Simply visit medsurgnursing.net, click subscribe, and enter promo code MSJSAVE50 to take advantage of this special discount.